Hi, uh, good evening, and welcome back to this session on the most frequently asked long essays in university exams. We were discussing about the topics of head and neck all this while. Some of you might have already done the dissection of the brain and started with neuro. So I thought, why not actually start with a topic which is like very frequently asked again when it comes to neuroanatomy, right? And in fact, like this could be the only question that most of the medical students might prepare when they study the neuroanatomy part, right? And this is about the functional areas of the cerebral hemisphere. And in your exam, most frequently, the cerebral hemisphere that they'll ask is the superolateral surface, nothing else. Okay, medial surface, inferior surface, nothing else they'll ask. They'll just ask the superolateral surface. Done? Are we clear? Right. So question goes something like this. Explain the functional areas present in superolateral surface of cerebral hemisphere. This is a straightforward question. This question could be converted even into a case-based question. I'll just try and tell you one example that I've seen in one of the universities. Okay, here is like a 50-year-old male patient who actually was brought into emergency department with sudden unconsciousness. On regaining consciousness, the patient had loss of ability to speak and weakness of the right half of the body. Which cerebral hemisphere do you think is involved? And which functional area of the brain do you think is involved? Or which sulci and gyri could be possibly involved? This is how the same direct question can be rephrased as a case-based question. So in this case, the examiner was asking about the Broca's area and where exactly the Broca's area is situated in terms of the gyri of the superolateral surface of the cerebral hemisphere. And then the next part of the question would be explain the superolateral surface of the cerebral hemisphere with respect to sulci and gyri, or explain the functional areas. So what we'll do today is we'll try and learn about the important sulci and gyri as well as the important functional areas present in the brain and how to answer this if this is asked as a question in the exam. So the first thing is we need to draw a diagram to explain this area. Now, my suggestion is draw one single diagram of the superolateral surface of the brain, right? So let's imagine this is the superolateral surface of the brain. And in this, try and show the functional areas as well as the sulci and gyri. Now, since they've asked about only sulci and functional areas, we'll focus only on that. So first thing we need to do is we need to draw the subdivisions of the superolateral surface. So from the parieto-occipital sulcus to the pre-occipital notch, if we draw an imaginary line, this will delineate what area? The occipital lobe. If we draw an imaginary line from the posterior ramus of the lateral sulcus, and let's imagine we draw the outline of the central sulcus. We have the four lobes. So what are the lobes that we have now? This is frontal. And what about this? This is parietal. This is occipital, right? And what about this? This is temporal, right? So this we know. Now in this, we need to identify the functional areas of the brain. If this is asked as a long essay, how do I go about it? So draw the diagram first, then your answer should be like functional areas, okay? Functional areas in frontal lobe, okay? Now, how do I go about answering this? To simplify, what we can do is, we can actually create a table. We can say area number, we can mention location, then we can mention function, and then we can mention clinical anatomy. So this could be the table that we are looking at. And once I give the example, it will become clearer to you. Right? Done? So Similar to this, we need to draw for, let's imagine, we'll do the same thing. Okay, so this is the functional areas on the frontal lobe. We'll just copy it. Okay, and we will paste it. Okay, we'll do one more paste. We'll do one more paste. Right? What we'll do is when we start writing it, we'll just redo the lobes. Done? Now, first, let's talk about the frontal lobe. Frontal lobe, the first important functional area is present as area number 4. So, area number 4. Where is it present? What sulcus is this, or what gyrus is this? This is the pre-central gyrus. Correct? So, where is the location? We can write it as pre-central gyrus. What about the function? Stimulation of this area leads to voluntary contraction of muscles of opposite half of the body. Done. This is the exact function of the area number 4. Right? Done. What about clinical anatomy? Clinical anatomy, any injury to this area will lead to contralateral hemiplegia. That is paralysis of one half of the body. Now, this is how you should describe and explain each functional area. I'm not just talking about the frontal lobe. I'm talking about all the lobes. Let's see further. Area number 4, we have done. In front of this, we have area number 6, right? Now, area number 6, let's say, is located in the superior, superior frontal gyrus. Okay, this is middle frontal gyrus. This is inferior frontal gyrus. Done? So, how do I write about area number 6? So, area number 6, so the name for this is primary motor area. What about area number 6? Area number 6 is premotor area. This is located in superior frontal gyrus. This is responsible for planning, right, and programming of movements. Planning and programming of movements. Done. So, injury to this area again will result in loss of coordinated movements. Done. So, area number 6 is over. Then, the next important area we have is in the inferior frontal gyrus, we have the area number 44 and 45. Possibly, this is the most important area that you need to remember in this frontal lobe, because this is what we call as the Broca's motor speech area. Right? So, this is Broca's motor speech area. Done. What is the function of Broca's motor speech area? Right? So, we will continue with the same. So, we have area number 44 and 45. What do we call this as? This is called as Broca's motor speech area. What is the function of this, or where is it located? This is located in the inferior frontal gyrus. We can in fact add it as pars triangularis. Okay, so that is the area where we have the Broca's area. Then what about its function? Remember, this is responsible for controlling the muscles of the larynx, right? Now, this is the motor speech area. So the words are basically formed here. And remember, this is located only on the left cerebral hemisphere. This is never seen on the non-dominant hemisphere. So instead of left, what we can do is, this is always present on dominant cerebral hemisphere. This is how we can answer. Area, when this area gets injured, this results in motor aphasia. or otherwise called as Broca's aphasia. Done? Right. So area number 44 and 45. Then what? Now here in the prefrontal region, let's imagine we have area number 9, right? This is the area of the frontal eye field. And then this entire area is the prefrontal cortex. So what do we write for this? Frontal eye field is area number 4 situated in the frontal lobe, in the middle and the inferior frontal gyrus. Stimulation of this area leads to voluntary deviation of the eyeballs. Injury to this leads to loss of voluntary deviation of the eye. Done? Then, what about prefrontal cortex? Prefrontal cortex is usually given the area number 12, and this is responsible for the abstract thinking, critical idea generation, thinking, personality, behavior, the way we dress, the way we talk, the way we behave with our own batchmates, colleagues, anybody, right? This is the function of the prefrontal cortex. That is what we need to write. Done? Okay. This is regarding the frontal lobe. So 5 important areas, frontal lobe. How about the parietal lobe? Parietal lobe, the first important functional area is present is 3, 1 and 2. What is this? This is what we call as post central gyrus or the primary sensory area. Now, what is the important function of primary sensory area? Primary sensory area or area number 312 will ultimately receive all the sensations in the body, every single sensation, right? So this is 312. And remember, the entire body is represented upside down. So if you talk about head region here, neck here, then trunk here, then lower limb is located like this. Okay, the upper limbs are located here. So the entire body is represented upside down, both in the motor cortex and the sensory cortex. This is what we actually also refer to as motor homunculus. Not required here. So pre-central, post-central gyrus, area number 312, where is it located? Post-central gyrus. What is its function? Stimulation of this area results in perception of all the sensory stimuli. Done? Right. Then, what about the other areas? If we draw the posterior ramus of the lateral sulcus upwards, and if we draw the superior temporal gyrus upward, enclosing this, we have 2 gyruses. Okay, let's label this first. This is area number 39 and 40, which is like referred also as the supra marginal gyrus and angular gyrus. These are also given the area number 39 and 40. Done? Why is this area important? We will discuss now. In the superior temporal gyrus, we have this area number 22, which is located in the Heschel's gyrus. So let's label this. This is superior temporal gyrus. Okay. Why are we stressing about these 3 areas? Remember, these areas put together. Right? Now, this is what we will refer to as the Wernicke's, right? Wernicke's sensory area. Done. If Broca speech area is responsible for spoken language, formation of words, Wernicke's area is responsible for comprehension of language by hearing, by vision, and by touch. Right? That is why we refer this area as the Wernicke's sensory speech area. Are we clear? Right? This and the Broca's motor speech area, every examiner will look whether you have written or not. So these are the 2 areas that you must never ever skip. Done? So in the parietal lobe, I want you to remember 2 important functional areas. One is the pre-central gyrus, which is the primary sensory area, and the other one is 39 and 40, which is a part of Wernicke sensory speech area. Done? Right. Now, apart from this, what else do we need to remember? So we have area number 44, 42, and here we have 22, 39, and 40. These are the Wernicke sensory speech area. Then the superior temporal gyrus itself will have area number 41 and 42. This is what we refer to as the primary auditory area. What do we mean by primary auditory area? Primary auditory area is responsible for perception of sound. Interpretation of that sound is the function of the Wernicke's area, which is area number 22, which is also referred to as auditory association area. Are we clear? So primary auditory area just receives sound impulses. Auditory association area, which is part of the Wernicke's area, helps in comprehension of the heard language. Who is speaking it? What is he speaking? All this is done by this area. Done? Right. Now, if this is 41, 42, is there any area called 43? Because we learned about 44, we learned about 45. Is there any area which is called 43? There is an area close to the lower part of the post-central gyrus. This area is also referred to as the primary gustatory area. What do we mean by this? This is the area that is responsible for perception of taste. Right? Gustatory area. Done. Let's move on to the occipital lobe. In the occipital lobe, let's imagine we have area number 70, 80, 90. Area number 70 is what we refer to as the primary, right? This is the primary visual area. And 18 and 19, these are the visual association areas. What is the function of primary visual area? Primary visual area is responsible for perception of light. Secondary or visual association area is responsible for interpretation of that light in terms of comparing it with previous memory and identifying what the object you are seeing. Are we clear? So association areas are much more important than the primary areas. Done? Now, if functional areas of the brain is asked, this is how you should describe the functional areas in the superolateral surface. Again, I'll repeat, you can do this table where we learned about how to answer it. Or the other way is, for example, write the name of the functional area. Name of functional area. Then mention its location. Then mention its function, and then mention its clinical anatomy. In this way, your answer will also look more voluminous. So let's give an example again. Primary visual area. So location, occipital lobe is a broad location. You can write calcarine sulcus, and that to the posterior end. Done? Right. What about function? Function is perception of light. And what will happen if this area gets injured? We will have blindness, which is otherwise called as anopia. Done. Now, regarding which part of the occipital cortex is involved, it could be quadrantanopia or something like that. But this is how you must actually write it. Done. So this is an important topic for your final exam, the functional areas of the brain. If you learn this, 8 to 9 marks is guaranteed. One diagram, description as I mentioned, if you can do this, nothing will stop you from scoring 8 or 9 in your exam. Done. So this is regarding the functional areas of the brain that I wanted to discuss. Next week, we will come back again with one more important topic. And once we are done with this, we will identify some of the topics for the thorax, and we'll start discussing this as well. Done. Right. So I once again thank each one of you for joining. See you on Thursday for histology slide discussion. See you next Tuesday for similar discussion on one more important long essay that is asked in your exam. Thank you very much.